Would you believe me if I said eye injections are a thing? Well, I bet you will after hearing this speech. Today, I'm going to inform you on a few aspects of the eye disease, wet macular degeneration. To start, wet macular degeneration deals with abnormal blood vessel growth, has a treatment process, and there are outlooks for the future for this disease. Having worked as an ophthalmic technician in a retinal clinic, as well as researching my topic, I can inform you about wet macular degeneration. I can tell you what it is, the treatment process, and the hopes of it for the future. Now, there are two subsets of this disease, dry macular degeneration and wet macular degeneration. Today I will discuss in more depth about wet macular degeneration, better known as wet AMD. So I wanted to start off by sharing with you all a short thought that I want you to keep in the back of your minds. Imagine you fall and you cut your knee. It bleeds, it scabs, and then it scars, changing the surface of your skin. Now keep this in mind. Let us begin by discussing what wet AMD is, who it affects, and the associated risk factors. What is wet macular degeneration, you ask? Wet macular degeneration is when abnormal blood vessels begin to grow below the surface of the retina and the macula, according to the American Macular Degeneration Foundation. The retina, and particularly the macula, are the areas in the back part of your eye that contain the cells that help you see. Since these blood vessels do not function correctly, as they begin to grow, they start to break, bleed, and leak fluid, leading to changes in the macular topography. This then can disrupt the vision. Now imagine a scar on the back of your eye. You could visualize how that could affect your vision. Macular degeneration primarily affects the older population in certain races. According to Kirsten Boyd, Director of Patient Education at the American Academy of Ophthalmology, AMD is the leading cause of vision loss in people 50 years and older. Also, being white increases your risk for macular degeneration. Your eye health is so important and should be taken seriously. There are several risk factors associated with macular degeneration. According to Mayo Clinic, age, genetics, cardiovascular disease, even smoking can all increase your risk of obtaining AMD. However, there are ways to reduce that risk, such as living a healthier lifestyle by eating more fruits and vegetables, consuming fish, and exercising. There are many reasons why not to smoke, and here is one more good reason. So far I've covered what wet macular degeneration is, who it affects, and the associated risk factors. Now let's move on to the symptoms and treatment of wet AMD. Any guesses? Great responses. Moving forward, I will express to you what symptoms to be on the lookout for, as well as a treatment option for wet AMD. First, it is always important to monitor your vision for any changes. According to Valencia Higuera and Healthline.com, a symptom can be a decrease in your central vision. This can include blurriness, the inability to make out faces, or even a dark area in your central vision. Another indicator I learned while working as an ophthalmic technician is when patients start to see an onset of distortion. This is when straight lines appear wavy. Moving forward, a primary treatment option for wet AMD is intravitreal eye injections of anti-vascular endothelial growth factor medication, better known as anti-VEGF. And yes, I said eye injections. According to Nancy Lovering and Healthline.com, anti-VEGF is a molecule that prevents the binding of vascular endothelial growth factor proteins that are being overproduced in your eye in order to inhibit abnormal blood vessel growth. That way, the message to form new but weak and leaky blood vessels is blocked. Yes, I know this may sound scary, but after being in the room with many patients receiving these eye injections, there is nothing to worry about. Having worked as an ophthalmic technician, I can describe to you one process of preparing to receive an eye injection. First, a numbing drop is added to the upper white surface of the eye by having the patient look down and towards their nose. Second, an antiseptic drop, known as betadine, is also added to the same area in order to remove any bacteria on the surface. Third, over the course of 10 minutes or more, 3 or more rounds of gel, in order to numb the eye, is added to the same location. Fourth, the doctor will come in and inject the medication into the prepared localized area of the eye. Here, the technique and process varies from doctor to doctor. Finally, the eye is thoroughly rinsed and the patient is good to go. In short, I have explained to you the symptoms and anti-VEGF therapy, including the process of receiving an eye injection. Now let's talk a little bit more about anti-VEGF therapy. Isn't it such a great feeling being able to see or to participate in something that makes a positive impact? You'll see what I mean in just a second. Now I want to share with you what to expect after an injection, how anti-VEGF treatment has helped, and hopes for the future for this disease. Let me explain to you what is expected and not expected after an eye injection. According to Rand Eye Institute, it is expected to feel some irritation or discomfort following injection. However, if you start to feel severe eye pain or a sudden decrease in vision, this is when you'll want to contact your eye doctor so they can rule out infection in the eye. This is very important. Now let's talk about the success of anti-VEGF treatment. According to the Marina study conducted by Philip J. Rosenfeld, MD et al., approximately 40% of patients receiving ranibizumab had 20/40 vision or better compared to the 11.3% in the sham injection group. This means that ranibizumab, the anti-VEGF molecule, is having a positive impact on patients' vision. All right, so what is in store for the future of macular degeneration? We know that anti-VEGF treatment is helping, but what else can be done? According to a Harvard Health letter, a couple of new approaches are gene and stem cell therapy. The thing about science, though, is that constant research is always being done, and so there is hope for the future for this disease. Finally, I have told you what to expect after an injection, how anti-VEGF treatment has helped, and new research methods for macular degeneration. So let's move on to a few main takeaways of this speech. In conclusion, I have shared with you a few aspects of wet macular degeneration. Wet macular degeneration deals with abnormal blood vessel growth that causes changes in central vision. We also explored the treatment of wet AMD and its process, as well as the possibilities of new therapies for the future. So, I wanted to leave you with a short story. My dad ended up needing these injections also, and he wouldn't have done it if I had not provided the supporting information. Knowledge is power, and it makes an impact. Thank you.